Hello, my name is Tori Hastings, and I am sharing a presentation on post-renal biopsies. This is my capstone project that I've chosen for this semester. And the goal of this presentation is to understand the risk for bleeding post-renal biopsy and the most effective ways to prevent it. Also to understand the benefit of lying completely flat for enough time to prevent bleeding, and I'll tell you a little bit more about that later on in the presentation. Students will be able to know what is most effective for a patient post-renal biopsy after this presentation. And so just a little bit of background. What is a biopsy? A kidney biopsy, a renal biopsy? It's the process of extracting tissue from the kidney to analyze it under a microscope. And so there are two types of kidney biopsies. There is the percutaneous needle biopsy, which is the most common. They take a needle and they extract some of that tissue. There's also an open biopsy where they do take a little small knife and they make it a little incision, and then they get the biopsy that way. And so percutaneous is the most commonly used biopsy. It's due to the fact that it has the lesser amount of risk for bleeding post the biopsy. So post-biopsy, there is the risk for bleeding, hemorrhaging, the development of a hematoma at the site, hematuria, so blood in the urine. And some of the prevention and precautions that can be taken are lying flat for hours post-renal biopsy. And this is what I'm going to touch most on during this presentation. The patient is going to lie completely flat. And even if they need to use the restroom, if they want to have a sip of water, drink, eat, they still have to be completely flat. So they're going to have to use a bedpan. They're going to have to use a urinal or whatever. They cannot get up and go to the bathroom, not even a bedside commode. They want them. The nephrologist recommendation is for the patients to lie completely flat for hours. Also, some other preventions and precautions are saving and analyzing the urine. They're going to take samples in urine cups, and they're going to be able to compare the coloring within the urine and see if there's any development of hematuria. And then also vital signs, lab draws, and then pain management for these patients. The problem that I want to touch most on is different hospitals require different lengths of time supine post-biopsy. And so a local hospital requires 6 hours completely flat, but many other hospitals require lesser times. They require only 2 hours, only 4 hours. And I do have some examples of that as well. And so the purpose is to explore the benefits of lying completely flat for 6 hours to reduce the risk for bleeding in patients compared to a lesser amount of times required by surrounding hospitals. And so my PICO statement is in patients post-kidney biopsy, how is lying flat for 6 hours compared to lesser times in preventing bleeding within the first day following the procedure. A little bit of background and significance of this topic is lying flat post-biopsy is a common practice, but the amount of time does differ. And if nephrologists are recommending longer lengths of time to prevent bleeding in patients, all these precautions should be taken. And so due to the high blood flow through the kidneys, which receives approximately 20% of cardiac output, the major risk of bleeding, the major risk of kidney biopsies are related to bleeding, and that is a quote from Powelson 2020. Just a little bit from my literature review. The American Society of Nephrology 2021 study, they did a study on 285 biopsies in 273 patients. 231, 81% of those biopsies were native kidneys, and 54 of those biopsies, 19%, were transplanted kidney biopsies. And so within these biopsies, the incidence of minor and major bleeding, 7 patients, 2.4%, developed microscopic hematuria. 4 patients, 1.4%, developed hematoma. 4 patients, 4.1%, developed both microscopic hematuria and a hematoma. 10 patients, 3.5%, required blood products. 1 patient, 0.35%, required both blood products and angiographic intervention. And so although these numbers are pretty low, there still is the risk for bleeding, which is why it's necessary to take all the precautions necessary to prevent any sort of bleeding instances within these patients and within this population. And so also within my literature review, many organizations, I did compare different organizations. Many organizations use the wording several hours to describe expecting amount of time to lie flat post-biopsy. So Johns Hopkins 2021 stated that patients will be asked to lie on their backs for several hours. The Cleveland Clinic 2021 mentions several hours to describe post-biopsy expectations. The National Institute of Diabetes and Digestive and Kidney Diseases, they also stated a few hours lying flat post-biopsy. And then Oxford University 2019 patient stated that patients will be asked to lie flat for 2 hours. Elizabeth's Medical Center, a teaching hospital in Boston 2021, stated the patient is monitored while lying flat after the procedure for 3 to 4 hours. Edinburgh Renal Unit, patients to rest in bed for 6 hours, but 2 hours are completely flat and the remaining 4 are sitting up. A Pediatric Hospital Children's Medical Center in Dallas recommends patients post-biopsy to lie flat for at least 6 hours. And so the proposal plan is that patients should lie flat for at least 6 hours for the longer amounts of time. Staff members are educated on nephrologist recommendations. And this is due to the fact that I've also seen within my unit that patients be sent up from the PACU or from, the OR post-procedure, and they're actually sitting up already without have waited the appropriate amount of time to lie completely flat. And I have seen firsthand that our nephrologists are not happy about that. And so staff members are educated on the nephrologist recommendations, and then research presented at other hospitals. If nephrologists are recommending longer periods of time, 6 hours to lie completely flat, then this research can be presented at other hospitals to benefit other patients within this population. So who's at risk? Patients post-renal biopsy, and the patients that are at risk are the ones that are not lying flat long enough post-biopsy. Limitation and barriers, lack of education, recommendation differences between nephrologists, lack of education, lack of research on this topic. Implementation. The proposal that I came up with was nephrologists interviewed on the benefits of lying flat for 6 hours. Recommendations, these recommendations from the nephrologist used to formulate those education resources for staff, And then post-procedure staff or in the OR should be educated on the nephrology recommendations. And then also any staff caring for the patient should be educated. The benefit. If nephrologists are recommending at least 6 hours lying flat, patients can benefit. And then in the long run, patients will benefit from taking all precautions to lower the risk of bleeding, no matter the risk, how great that risk is, how low that risk is. Patients at the end of the day will benefit from taking all these precautions. On my specific unit, there was actually a patient within the last few weeks who was educated on the amount of time to lie completely flat. This patient was found in their room sitting up, eating, and had just walked to the bathroom, and they did not wait the appropriate amount of time. And this patient ended up developing a significant amount of hematuria, bright red urine, developed a hematoma at the site. And it's hard to say that not waiting the amount of time was the cause of these symptoms, but the patient did not wait the appropriate amount of time, and the nephrologist recommended the 6 hours, and we're not happy about that, and this patient ended up having a longer length of time in the hospital, costed the patient more time in the hospital, which is going to make the cost of care higher, and not only the cost of care, but this patient was required to stay a longer amount of time than normally recommended for these patients. Evaluation. So if staff members are educated, at the end of the day, consistent care would be provided to every post-renal biopsy patient. And if longer lengths are implemented, at the end of the day, all precautions would be taken to prevent any possible risk for bleeding. I'm actually starting a nurse residency in 2022, and this is a research proposal that will be presented, and this can provide the hospital with education resources. Surveys can be sent to staff assessing knowledge of the post-procedure process and recommendations from the head of nephrology. And then once my residency is completed, and nursing staff who present your research proposal can actually present at conferences and present evidence-based practice to implement changes in hospitals all around the state. And so if these longer amounts of time are recommended, then that can be presented at other facilities, at other hospitals. And so just in summary, renal biopsies are a common procedure in hospitals, but post-renal biopsy care does differ from facility to facility. Common practice is to lie flat for hours post-biopsy, but that time can differ. A local hospital does require 6 hours post-biopsy to lower the risk of bleeding completely. Education resources and proposals can help educate staff on the recommendations, and then further research and presentations can help present change in other hospitals as recommended by nephrologists. And so thank you for listening to my proposal, to my topic. It's not a significantly common topic, but any way to lower the risk of bleeding in any patient population is ideal. It's patient safety. it's at the end of the day going to lower any potential cost of care if these patients are not taking the necessary recommendations and develop these symptoms. They could have longer care. And then yeah, if staff members, if you as nurses ever come in contact with a post-renal patient, you'll know that these patients should be lying flat post-biopsy, post-procedure, and this is due to the fact that it lowers the risk of bleeding instances within this population. So again, thank you very much for listening, and good luck to everyone.